Doctor, the patient's blood sugar is 21. Which one of the following options is correct? The answer is none of them. High blood sugar or hypoglycemia is a very common problem encountered in clinical practice, particularly when you're on call. Here's a simple 3-step guide to make the process smooth for you. Step number 1. Check the patient's HbA1c. HbA1c is a measure of the amount of glucose attached to the red blood cells. Now, red blood cells are in the circulation for 3 months, so the HbA1c must be within the last 3 months to be valid. Here is a simple formula. Take, for example, the patient with a blood sugar of 21. If her HbA1c is 120, this is the formula. Take 1 decimal point, 12, times by 2. 24 minus 2 is 22. This means that this patient could run blood sugars up to 22 without running into hemodynamic or homeostatic complications. Also, it's unlikely that this patient will run blood sugars 10 or less because their blood sugar is poorly controlled with a HbA1c this high. Step 2. Clinically review the patient and make sure that they are clinically stable. Of course, if they're unstable, treat them accordingly. Step 3. In the same patient, if her HbA1c is 120, eating and drinking with no concerns, this blood sugar of 21 is an okay range for her. Therefore, tell the nurse to repeat the blood sugar and do a ketone check. And don't worry, always check the latest HbA1c if there is one. Check their blood sugar control, check they're taking the insulin. I hope you found this helpful. Put this into practice. And don't forget to subscribe.